Welcome to the Hashimoto's Doctor podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started.
Hey guys, Dr. Shook here. I hope you're doing well today. Today I want to talk to you guys about a very important topic, which, this is going to be of interest to men and women. But I'm going to talk about it more from the perspective of men, though a lot of these concepts are going to apply directly to women, okay? So this is something that's super important, and most of my listeners and most of my followers are actually women. But ladies, this is really, really important for you to hear, because this is going to relate directly to your husband and their mental health, their sexual health, their happiness, and ultimately that's result in affect your happiness. So what I really want to talk about today is low testosterone, or sometimes you'll hear about it referred to as low T. You guys, if you have listened to any of my podcasts, any of the information that I teach, I always want you to ask a question, and that question is why? Why is my testosterone low? You do not look at these sex hormones and just say, well, they're low, we need more. That is not at all trying to understand why the person has low testosterone or low of any hormone is low or imbalanced. That is not trying to understand the why or the reason why it's occurring. It's merely just throwing a medication or a hormone case at the person's symptom to try and help them feel better with complete disregard for the actual reason why this is occurring. The thing that's really important about this is that is a dangerous strategy. Just throwing hormones or medications at a symptom is a dangerous strategy. It creates lots of, some people will say that drugs have side effects. I say drugs have effects. That's not a side effect. That's what the drug does. It's an unwanted effect of the drug. It is a known effect. And taking testosterone or some of these other hormones can have very nasty effects. And that's why you have to investigate and try to understand, why is this happening in the first place? And what can I actually do about that? The cause of the problem, the cause of my testosterone to be low. So here's something that's really important to understand. As men age, it's kind of a misconception. People don't realize this. Their total testosterone. Now listen guys, we have total testosterone and free testosterone. Just like we have total thyroid hormone and free thyroid hormone, right? Like total T4, free T4. Total T3, free T3. Guess what? You've got total testosterone and free testosterone the same way. And the important thing to understand here is that men, as they age, guess what? They actually tend to produce more total testosterone. That's right. But it's the free testosterone that goes down, that tends to go down in men. And most of the workups that are done in most clinics are looking primarily at the total testosterone levels. Now, if you go to anti-aging clinics, and some doctors may get total testosterone and free testosterone for someone, but they're still not thinking about mechanism. Why in the world is this happening in the first place? Most of the time, it is simply a replacement model. You come in with low, you're getting more. All right, you got it? So that's a problem. Nasty side effects. Listen, guys, I'm getting ready to explain some things to you that are very important for you to understand. So the most important thing you need to understand is, why is this occurring in the first place? Why is the testosterone low? What we find out is that there are several mechanisms behind why you might have low testosterone. What I find to be probably the most common cause of low testosterone is due to the fact that there's inflammation, there is either high cortisol, the stress hormone cortisol, or there's high insulin, which basically means that blood sugar is fluctuating up and down. And probably, the blood sugar fluctuations up and down is one of the most common things that I see occurring here. What that does is it spikes your insulin. That causes your insulin to upregulate or increase these enzymes that will cause you to take your testosterone and make it into estradiol. So what's happening is in men, we should typically see estrogen testosterone ratios of about, let me say this, testosterone to estrogen ratios of about 50 to 1. 50 times the testosterone than they do the estrogen. But what we're seeing is that a lot of men are having these, much lower levels, like 5 to 1 or 10 to 1, which is what's occurring there is that their testosterone that their body's making is being converted into estrogen, in particular die-off and through this enzyme called aromatase. That enzyme aromatase is increased in activity due to blood sugar fluctuations, inflammation, and cortisol levels that fluctuate, typically higher cortisol levels. Now, the other thing that can happen is, so just like we talk about the thyroid gland, there's the brain signals the thyroid to make thyroid hormone, right? So there's the hypothalamus that signals the pituitary gland to make TSH. The pituitary gland, TSH, signals the thyroid to produce T4 and T3. And then as the thyroid hormone levels go up and down, the brain measures that and monitors it and adjusts its signaling of the thyroid in order to keep the hormones in balance. Okay, that's a feedback loop, guys. That you have the same feedback loop with testosterone. Now, what happens is that in males, your body will produce luteinizing hormone. The pituitary gland will produce LH, luteinizing hormone, that signals test, and in particular the Leydig cells, the cells of the testes, to produce testosterone. Testosterone levels go up, the hypothalamus senses it, and adjusts the hormone output accordingly to keep it in balance. Now, you can have pituitary suppression of LH. Like you can have suppression of LH, pituitary release of LH, pituitary suppression of LH release. Stress, inflammation are very common reasons. Taking testosterone, like utilizing testosterone hormone hormone replacement therapy, supplementing with testosterone injections orally, however, can increase testosterone levels and break your feedback loop mechanism. So you literally stop producing LH, and if you're not making LH, we can look at LH, luteinizing hormone, and compare it to TSH, which is produced by the pituitary also. We can look at them as in the same way. For example, we know in the thyroid that if TSH levels are high, and we would expect, if the feedback mechanisms were working properly, high TSH would suggest that we're going to see low total T4 hormone. Okay, so that's what we would typically think. If TSH is high, thyroid hormones are low. If TSH is low, thyroid hormones are high. Well, in men, what we'll see is that if LH, luteinizing hormone, is high, we would expect to measure testosterone in the blood low, right? Just like the thyroid, high TSH, low thyroid hormone. When we're talking about these androgens, high LH, low testosterone. Okay. Now, if we found that we had low LH, we would have really high testosterone, right? Because that would suppress the LH output, the luteinizing hormone output. So that the main thing here is that you cannot just measure. I'm getting to another point here. You cannot just measure the total testosterone or free testosterone. You need to look at the pituitary hormones, just like we do with the thyroid, to see what's happening. We need to look at blood sugar. We need to look at a lot of the factors that will influence and upregulate aromatase activity. There's even a possibility that we need to look at the pituitary hormones, because we can also, just like we have Hashimoto's, where the immune system attacks some of the ingredients, the TPO and thyroglobulin that are needed to make your T4 and T3 hormones in the thyroid. Your immune system can also attack the Leydig cells of the testes and cause you to have decreased output. So you may have Leydig cell autoimmunity, so an autoimmune process against these cells that produce testosterone. So we need to look at the LH, the output of the LH hormone from the pituitary. We need to look at total testosterone, free testosterone levels. We need to look at blood sugar markers. We need to look at inflammatory markers. We need to look at the Leydig cells and to see if there is any autoimmunity there. And what I'll do is I'll take an approach where we literally take and put antioxidants in a transdermal cream. Like I'll do this even if it's not, we don't know it's present, and we will apply. This might sound it is what it is. If you understand what the science is, if there's nothing odd about it, it makes sense. But I'll actually have men now, especially if we know that there's testicular autoimmunity, we'll put a glutathione cream directly on the testes. It's a super antioxidant that will go transdermally right into the testicles and help to decrease that inflammatory response. And this is really important to do, but we also utilize a lot of other anti-aromatase creams. We use a lot of supplementation. Diet is obviously very important. We just want to get to the root of the problem, guys. So I hope this has helped you to better understand problems and some of the potential issues that men and women can be experiencing, because what's driving these things? Inflammation, blood sugar, autoimmunity. There's a lot of common threads. That's why we gotta test and see what we find, and address the things that we show up abnormal on tests. You guys, I appreciate you hanging out with me today. I really appreciate your time. I hope this has helped you better understand some of these problems. And if you guys need anything, don't hesitate to reach out to us. Remember, I do distance consulting around the world. We also work with people in small groups of 30, especially focusing on toxins in our environment. If you want to learn more about that, you can go to nomoretoksikbody.com and register for our next webinar. We only take small groups of 30 people once per month, and I work with 1 or 2 people per month one-on-one. So I appreciate you guys. Hope you have a wonderful, wonderful day.
Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.